get-together session. My name is Hendrik Dietrich. I'm the Science and Technology Managing Editor at getAbstract. In today's get-together session, once more we'll have the opportunity to talk about the novel coronavirus pandemic with Dr. Martin Nufer, who is the director of the Hirslanden Clinic St. Anna in Lucerne, Switzerland. Welcome, Dr. Nufer.
Hello.
As before, our viewers have the possibility to ask some questions. Please post your questions in the chat and we'll pick them up later on. As of today, the World Health Organization has confirmed about 2.3 million cases of COVID-19 and almost 160,000 deaths. Dr. Nufer, you are the director of a private clinic in Lucerne, in Switzerland. Last time we spoke, almost a month ago, you told us that you were still preparing for COVID-19 patients to arrive. How's the situation now?
Well, there have been very few patients in the canton of Lucerne, which is in the heart of Switzerland. Whereas in southern Switzerland, in the canton Tessin, there have been a lot of patients spilling over probably from Italy. In central Switzerland, there have been only very few, meaning we have 2 to 3 or 4 patients per day and probably 1 patient in the intensive care unit intubated. But there are fortunately a lot less patients than we prepared for. Overall in Switzerland, we have some 25,000. If we count also those we have not registered, we're talking about probably 150,000, meaning roughly 1.52% of the overall population is affected.
Okay.
So very small number.
Okay, so my next question would have been our efforts to flatten the curve aimed at reducing the numbers of COVID-19 cases to a level that the health system can handle. But then in Switzerland, you're saying this is still the case, so we're not running out of capacity there.
No, I don't think there has been a place which has been at capacity. If there has been a place, it was the southern part of Switzerland and the western part, Geneva, Lausanne. They had many patients coming from France or from Italy, but the rest of Switzerland has been remarkably quiet.
And we also have heard of cases in which hospitals had been hotbeds of COVID-19, so helping the virus actually spread. So are hospitals safe? That's another question I would have.
Good question. Comparing to other viruses, it seems that many younger persons can have the virus without any symptoms. This seems to be different, for instance, to the seasonal flu, where usually that's not the case. I mean, you can have the seasonal flu without symptoms, but that's rather rare. And with the COVID-19, it seems to be for younger people more the standard and not a special situation. And many hospitals have transmitted viruses from their employees to patients because at the beginning we didn't know that. In the meantime, however, we have a lot of measures are in place, personal protective equipment, for instance, and I think now we learned our lessons and hospitals are, life is never 100% safe, but very safe compared to 6 weeks ago.
Yeah, and so the
in
viral
in our hospital, we have not had one single transmission registered so far, but as I said, it's with very few patients and with very few infected employees.
Very good. So as you said, the viral shedding, children can pass them on. People who are infected can, pass the virus on before they show symptoms and even after they show the symptoms. That seems to be one of the crucial points with this virus. So far, it's been more than 200 countries or areas or territories that have been affected. And in some cases, like in China, the situation is improving. In Europe, we are lacking behind still, and the US is experiencing an unprecedented challenge, and other places are not even affected yet. So the time when the virus enters a country or area or territory is certainly critical. But the dynamics of spreading of the virus through the population depends on a multitude of factors. One being the measures that local governments take, and those differ. So, what measures have been taken in Switzerland and have they been effective?
We have shut down many businesses and schools. We implemented social distancing in a way that is very impressive for me. Um, Most people respect what the government asks from them.
Mm-hmm.
They stay at home. Streets are empty in the
Yeah,
night, and people really stay away from each other and do this distancing in a quite a good way. Um, yes, we try to flatten the curve, and we seem to have managed this. However, if you look at different countries, for instance, Financial Times has a nice website comparing different countries. Um, our first goal to flatten the curve, I'm not sure whether we really managed it. We did flatten it, yes, but I'm not sure whether it's still a curve. A curve has an upward slope and a downward slope, and quite a few countries now going horizontally on, and it remains to be seen what actually is happening.
hmm.
Have we slowed down the spreading, but probably not stopped as we can see it, or as it is shown in China, where
It
actually
goes
the
down.
curve
Yeah.
has dropped to zero
Hmm.
all over.
Hmm.
And many countries are going horizontally, and I'm not sure what's going on. We have 1 to 2% of our population affected, and I'm pretty sure this is going to be going on over the next couple of weeks and months. And it's not a complete drop to zero, and we can go back to regular life as we are
Do it
used to,
before.
have been used to a couple of weeks ago. So
Yeah.
this is going to be around for a couple of weeks and months further.
Yeah, absolutely. And the lockdowns also exert a massive impact on our economy. Um, and not every country or area or territory affected by the pandemic has been locked down. So Sweden, for example, doesn't lock down people, but asks them to the usual, stay at distance, avoid gatherings, wash hands, stay at home if you get sick. And in South Korea, where the situation is also massively improved right now, um, they never locked down the entire population in the first place. So they have conducted massive testing and they try to isolate the cases while the rest of the population were able to go about their daily business. So this surely will reduce the pandemic's impact on their economy. But geolocation data from smartphones has been very essential in the monitoring of the spread of COVID-19 in South Korea, which has raised some privacy concerns. So, when are lockdowns useful and effective? And would citizens in Western Europe or in the US be ready to give up parts of their privacy to help mitigate the spread of the virus?
Oh, tough question. um, what you need to have is that a large amount of population does a buy-in. It doesn't help if 50% of the population follows one of the measurements
Mm.
we try to implement. We had a discussion in our medias in the past couple of days about those data, digital data,
Yeah.
privacy concerns. And I think that Swiss people probably are somewhat reluctant
Mm.
if they don't know who gets what kind of data.
Mm.
If I, as an affected person, get a message back that I actually had contact and need to be aware, needs to do social distancing, that might be acceptable for most of Swiss people.
Mhm.
But if those data are collected somewhere centrally, I don't know exactly who gets access to those data and what kind of data actually are collected. We might be more reluctant. And that might be a cultural difference between Switzerland and South Korea, which makes it hard to follow these measures.
Yeah, absolutely.
Social distancing, on the other hand, might be more acceptable for us because it's in our hands. It's my decision what I'm going to do, where I'm going to take risks, and it's in our hands, and that might be more acceptable.
Yeah. But let's talk research for a moment. So, the efforts to develop vaccines and drugs have increased worldwide. The scientific journal Nature Reviews Drug Discovery reports 78 vaccine projects ongoing worldwide. Yet, it will take time until they get available. I just saw a local newspaper report today that talked about one of the labs in Switzerland that are working on a vaccine. Um, it's one of the University of Bern where they try to create a so-called virus-like particle, a virus dummy that they may be able to delve it into a vaccine. Um, and my question is not only like last time, how long will it take for the vaccines to become available? But I think what people increasingly also asking is how will it be rolled out? So if a vaccine is developed in a certain place, will people living close to that place get it first? And will people living remotely from that place get it last? What is your take on that?
Well, immunization have become more important than 6 weeks ago because then you remember we were talking about herd immunity,
Yes.
and I think herd immunity is a long way from being realistic. We try to contage the virus or the people spreading the virus spreading to many people. So herd immunity is not an issue right now. So that brings us to vaccines. Everybody who thinks they have some idea about building vaccines, they're now trying to get one of these because it's going to be worth
Selling a
gold,
lot. Yeah.
pure.
Mm.
But I think it's going to take still take a while because doing the research is one thing. Then you have to test it, and you can't shorten the tests to just zero because you
The
need to
clinical
have the
phases, you mean, right?
clinical phases, yes,
Mm.
because it just takes 14 days if you get the virus until you get the symptoms and you can be tested positive. So you can't shorten that duration.
Yeah.
And after that, you need to go into production, and then you need to do the distribution. And of course, there will be some nationalistic issues there that those countries who produce the vaccine will be the first to profit from it. And there is the economic factor. Those countries who can afford the vaccine will get it earlier than the others. Um, can't fight against that.
Mm.
I read the article too, and very positive is that those guys say that production actually scaling up the production is not a big issue.
Mhm.
So if that is right,
Yeah.
we might be able to produce a rather large amount of vaccine in a very short period of time, and
And that's a
that
question
makes
of logistics then. I mean, if
right,
one
right.
would succeed in that and it would be scalable, then it's a question of how to, get it around the globe.
But still, don't count on it that the vaccine will be available the next couple of weeks. I'm
Mm.
still pretty sure that it's going to take months,
Mm.
many months, to have a vaccine available.
And in the meantime, especially when people emerge now from the lockdowns, how can we protect those who are most at risk?
Oh, right. It's still kind of social distancing on one side and kind of not bring too many people close to you. I mean, there are several ways of transmitting the virus. It's via direct contact. You have some fluids on your hand, you shake hands, you transmit it via direct contact.
Hmm.
Then you have the indirect contact. You touch a cup of coffee, you have some virus on your hands, you leave it on the cup of coffee, somebody takes the cup and puts it in the dishwater, and that the transmission is positive. Then you have the small droplets of fluids and then the aerosols. And the indirect contact might be a bigger issue than we were thinking before, because there are some studies that the virus actually survives on some surfaces up to 3, 4, 5, 6, 7 days. And so if you don't have people around you
Mm-hmm.
who can possibly bring the virus on surfaces you touch afterwards,
Mm.
that makes you safer.
Yeah,
So the
absolutely.
less contact you have, the less
The better, yeah.
there's the opportunity of a
Mm.
transmission of the virus from somebody who has it.
But you know,
But
that's
that comes with a
sorry.
price. It comes at the price of social distancing, being on your own, which is not easy as well.
Absolutely, yeah. But you mentioned right now that some data showed that viruses can survive on surfaces, but I also heard other reports and sources saying that the virus isn't that stable on surfaces, stuff like that. So during the past days, we have heard talk about the relaxation of the measures in Switzerland, in Germany, other places. Do we actually have enough scientific data yet to take an informed decision? And when is the right time to start relaxing the measures?
Very tough question.
Yeah, I know.
For normal times, we don't have enough data, but these
Mm,
are not normal times.
mm,
Um, Crises require decisions without or with limited knowledge in very short period of time. There will be false decisions, and we
mm,
need to accept these kind of situation. We need to tolerate that there might be some uncertainty um, related to those decisions, which need to be made now because of the economic pressure.
yeah.
But there
And to
will
the
be
best of
false.
our knowledge, I guess. Yeah.
Absolutely. You mentioned the vaccination before.
Mm,
I mean, we can shorten the time for the development, but imagine there will be 1 or 2 deaths after vaccinations.
mm,
This will bring everything to a full
yeah.
stop. And these are the risks we're dealing with right now. And let's try to make it the best we can. But these are not normal times.
Yeah, yeah, and that also probably answers my next questions, which would be, should people wear a mask? Is that still recommended for everyone, or should people sterilize surfaces? So, are you saying, okay, let's try all the measures just to be sure, or is there a shortage of masks so that we can't do it? What do you think about that?
Well, don't get psychotic about that. I mean, if you're at home and you're on your own or with your spouse, your husband, you don't need to sterilize the surfaces all the time because it's just the two of you.
Mm,
But in a company like ours, you have the button of the elevator, and many people are touching this button. So, yes, we
yeah,
need to sterilize it every other 15 minutes. That makes sense.
yeah,
With the masks, actually, the scientific data are not very good. But that probably is because we are not used to wearing those masks.
mm,
It only helps if you don't touch the masks,
mm,
but we are so used to touching the nose, the
mm.
mouth, and if you
That's
wear a
a question
mask,
of
you
habit.
always,
Yeah.
yeah, right, and you
Yeah.
transport then the virus to some surfaces, and that's the problem.
Mm,
Um, and if you can wear a mask without touching it, which is
mm.
very hard, then it helps. If you're
Absolutely.
touching it, it
Yeah.
doesn't help. So if you're not used to, probably doesn't help.
Yeah. And the other day I saw a sign on the entrance of some pharmacy which said, okay, we're desin, we're sterilizing this every few minutes or something, and that's a perfect place where it makes sense because different people
Absolutely.
getting there and they may be
Absolutely.
infected. I also saw, maybe that's less of a problem here if you say the places are not like overcrowded yet, or I'm not sure about the hotlines that you have here, but I heard of places where the hotlines, you know, people were not able to help those people who call and ask for help. And then there's one example that that caught my attention. Partners Healthcare in Boston, they developed an AI, an artificial intelligence-based COVID-19 screener. So it's actually a chatbot presenting questions about symptoms and possible contact with others. And depending on people's answers, it helps assess whether the patient should be evaluated for COVID-19, whether it's recommended. Is that a glimpse into the future of medicine?
I don't think so, because we had these algorithms for many years now.
Mm-hmm.
You put together the most important questions,
Mm-hmm.
you assign some points, you add it all together, and you have a pretty good idea what's going on. The glimpse in the future might be more that we're a lot more into telemedicine.
Mm-hmm.
That means we're talking to the patients via a tablet,
Mm-hmm.
and actually, it shows that this is for many times it's really doable. It works. Doctors usually are very conservative. They having a hard time using those new technologies,
Mm-hmm.
and COVID-19 now forces us to use those technologies, and it works in a lot of cases.
Mm-hmm.
Of course, once in a while, I don't know, 30 or 40%, you need to see the patients in your office anyway. But in the other 50, 60%, it actually works. And that, I think, is the glimpse into the future. We're treating or counseling patients a lot more via their phones, tablets, computers.
Mm-hmm. So, which brings me, I guess, to one of the last questions, and then I want to look up the question that we have here. How does medicine work these days? So the search for knowledge, the evaluation, and the way it's made publicly available. We have an unprecedented global urgency. The way the public puts pressure on the healthcare system through the media is enormous.